Fentanyl is an opioid analgesic used to manage severe pain in opioid-tolerant patients, breakthrough pain in cancer patients, as an analgesic supplement in general anesthesia, and for pre-op pain relief. Fentanyl binds to the opioid receptors in the central nervous system and reduces stimuli from sensory nerve endings. It inhibits the ascending pain pathway and alters pain perception and increases pain threshold. For intravenous and intramuscular routes, if using fentanyl for preoperative pain management, administer 50 to 100 micrograms 30 to 60 minutes before surgery. For postoperative use, administer 50 to 100 micrograms initially, and then the dose can be repeated in 1 to 2 hours as needed for pain management. If using fentanyl as an adjunct to anesthesia, administer 50 to 100 micrograms in adults and children 12 years and older. For the intravenous route, it requires a slow IV injection over 1 to 2 minutes. If administered too rapidly, it increases the risk of severe adverse reactions. The initial dose for a transdermal patch is 25 micrograms per hour and lasts 48 to 72 hours. The patch is to be used only for those who are opioid tolerant and experiencing chronic pain. Apply the patch to a hairless area of intact skin on the upper torso and rotate application sites. When disposing of fentanyl patches, carefully fold it in half and discard it in the toilet. Buccal tablets, oral lozenges, intranasal and sublingual sprays are indicated for use in opioid tolerant cancer patients with breakthrough pain. The dose for a buccal tablet is 100 micrograms. Place the tablet between the upper cheek and gum and allow it to dissolve over 30 minutes. The dose for an oral lozenge is 200 micrograms per unit and should not exceed more than 4 units per day. Do not chew. Suck lozenge vigorously for 15 minutes and allow it to dissolve. For the intranasal spray, the initial dose is 100 micrograms but can reach a max dose of 800 micrograms. Wait at least 2 hours between doses and do not administer more than 4 doses in 24 hours. Prime the device by spraying into a pouch, then insert the nozzle into the nose and press down firmly. Do not blow your nose for at least 30 minutes following administration. The sublingual spray is administered under the tongue and the initial dose is 100 micrograms. If the pain is not relieved in 30 minutes, the 100 microgram dose can be repeated. There should not be more than 2 doses administered per breakthrough pain episode and wait 4+ hours before treating another episode. For subsequent episodes, increase the dose to 200 micrograms, then 400 micrograms, 600 micrograms, 800 micrograms, 1200 micrograms, with the max dose being 1600 micrograms. Common adverse reactions and side effects of fentanyl use are arrhythmias, bradycardia, circulatory depression, hypotension, facial itching, blurred and double vision, adrenal insufficiency, biliary spasm, nausea, vomiting, constipation, diarrhea, skeletal and thoracic muscle rigidity, confusion, paradoxical excitation or delirium, postoperative depression, and postoperative drowsiness. Life-threatening reactions include apnea, laryngospasm, and respiratory depression. Fentanyl is a Schedule II controlled substance and is considered a high-alert drug with a high risk for abuse, toxicity, and fatal overdose. Use with alcohol and benzodiazepines can increase CNS depression and may result in profound sedation, respiratory depression, coma, and death. When administering fentanyl, have Narcan readily available. Be aware of the signs of an overdose. These include trouble breathing or shallow respirations, tiredness, extreme sleepiness or sedation, inability to think, talk, or walk normally, faintness, dizziness, or confusion. If you are taking long-term, do not abruptly stop taking as this can induce an opioid withdrawal. It must be slowly tapered. Contact your provider if breakthrough pain is not alleviated, if pain worsens, if greater than 4 units a day are required to control pain, or if opioid effects occur. The black box warning for fentanyl is that physical and psychological dependence may occur with prolonged use. It may cause life-threatening hypoventilation, respiratory depression, or death. Use with a CYP3A4 inhibitor may result in potentially fatal respiratory depression. Buccal tablets and lozenges contain enough medication to potentially be fatal to children. With transdermal patches, serious and life-threatening hypoventilation has occurred. Limit use to children 2 years and older. Do not take fentanyl if you have a hypersensitivity to fentanyl, if you are not opioid tolerant, or if you have acute or severe bronchial asthma. Take precautions if you have bradycardia, renal, hepatic, or respiratory diseases, a head injury, altered level of consciousness, biliary tract disease, acute pancreatitis, cor pulmonale, significant COPD, increased intracranial pressure, are elderly, have morbid obesity, a history of drug abuse, misuse, drug-seeking behavior, and dependency, or if you have taken an MAO inhibitor within 14 days. Avoid grapefruit juice when taking fentanyl.